Hi, everyone. It's your host, Dr. Janice Castro, on the soft launch for my upcoming podcast on ADHD. I'm super excited to launch it, and I thought, why not give y'all an opportunity to see what you could expect from a solo episode? Because I'm gonna mix it up. We're gonna have conversations with people, and then there's gonna be conversations where I'm talking all about myself. So I do want to bring up 3 points. One, this is not a replacement for therapy. I am a therapist, but I ain't your therapist. Number two, I also want to recognize that while I specialize in adult ADHD, I do not fully understand the experience because I don't have ADHD. I'm neurotypical. And I will share in my intro episode, the first episode, as to what led me to want to start one. Why do I specialize in it if I don't have ADHD? And then number three is being mindful of language. So on today's topic, we will be talking about girls and women with ADHD and their menstrual cycle. When I say girls and women, I am referring to females assigned at birth. And I also want to acknowledge that, unfortunately, there is very limited research when it comes to ADHD and women and their menstrual cycles, which is not surprising and still very upsetting because women are often overlooked in terms of ADHD. And then also, in general, when it comes to the research related to women's bodies, there's not a lot out there. And it makes sense because historically, men were in schools. So there was a point where women couldn't even go to schools or even work, right? So yeah, we've got a long way to go, but we're going to work with what we got, okay? So what we got today is we're going to start with the foundation that brain scans have shown that people who have ADHD demonstrate in these brain images that there is less dopamine and norepinephrine compared to brains of people who do not have ADHD. So keep that in mind. Two chemicals that are less of compared to non-ADHD brains, there is less dopamine and norepinephrine. Non-ADHD brains, they're good. They have enough dopamine and norepinephrine. When we think about the menstrual cycle, there are 3 hormones to consider: estrogen, progesterone, and testosterone, okay? And when you take into consideration these hormones and these ADHD chemicals in the brain, oh my goodness, it's a roller coaster. So let's get into that roller coaster because we want you to understand what it's about. And so as a woman, I have been learning this as an adult. Nobody taught me about this. So week 1 is the menstruation or the period. This is when we in our flow and estrogen starts to rise. And guess what the research is showing? Estrogen rises, dopamine rises. Dopamine rises, your performance for attention-focused tasks rises. We're going way up. We're going way up. Week 1. Week 2, what do we got? Is the follicular phase. So this is when estrogen and testosterone increases and progesterone decreases. Unfortunately, the research between progesterone and dopamine is unclear. So I can't even speak to progesterone. What happens when it increases and decreases during the menstrual cycle? I don't know. A lot of us don't know. But what we do know is that the estrogen and testosterone has still continued to increase. So keep at it with those attention-related tasks because this is the ideal time to challenge yourself to do things, all right? And then week 3, this is the ovulation. So during the ovulation, this is where things shift with estrogen. It decreases and the progesterone increases. But we ain't even gonna get into the progesterone because, like I said, it's unclear with how it's connected to dopamine. But estrogen decreases, then what's been noted anecdotally. So these are like quotes from people that have been incorporated in like some of these articles that I've read. So these are, I would consider it in the research world is qualitative data, but it ain't even analyzed. It was just like included in some articles. They've noticed that when they are in that ovulation phase, there is a decrease in performance. And what ends up happening is that women with ADHD start to experience irritability, forgetfulness, impulsivity, and difficulties managing their emotions, also known as emotional dysregulation. So maybe week 3 during ovulation is the time when women want to be more mindful of self-care and maybe taking on a few less tasks or delegating tasks or asking for help or saying no, setting boundaries. And then what happens week 4? This is the luteal phase. This is when you are in your final week before your menstrual cycle. This is when you may notice poorer attention, higher anxiety, higher feelings of stress, or some women experience more severe symptoms of this PMS time, the premenstrual cycle, the week 3. Some women experience premenstrual dysphoric disorder. If you have concerns of possibly having ADHD or the premenstrual dysphoric disorder, I would encourage you to reach out to your mental health professional, therapist, or your medical provider, because this is something that you want to get help for. But this is when you don't want to be doing much. You want to delegate a lot of tasks. So that is it for the 4 weeks of our menstrual cycle and how it affects ADHD. In conclusion, more estrogen, more dopamine, increased performance. However, this cannot generalize to all women, right? We all have different experiences with our periods, especially depending on your age, your health conditions. But I just want to give y'all a little tidbit about what the research, unfortunately limited research, is showing. And don't forget to subscribe to my YouTube channel because the podcast has videos. So not only will you be listening on whatever platform you listen to podcasts, but y'all can get videos on YouTube if you subscribe. Thank you.